90% of men experience some type of problem with their prostate by the time they're 70 years old. And one of these problems is prostatitis. Most women with prostatitis suffer from frequent or painful urination, pain in the pelvic area, lower back, painful ejaculation, and much more. So in today's video, I'm going to reveal how to cure prostatitis symptoms naturally and effectively. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. In this channel, as a conventional doctor, I treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to receive notifications and be the first one to watch a new video. If you need to line an appointment or quality supplements for your disease, visit drlandivar.com. I encourage you to stay till the end of this video where I'm going to reveal extra tips and video links related to this topic. Prostatitis, as its name implies, is the inflammation of the prostate. And this condition is divided into four important categories: bacterial prostatitis, which is inflammation of the prostate caused by bacteria; chronic bacterial prostatitis, which is the recurrent bacterial infection of the prostate; chronic pelvic pain syndrome, the most common type of prostatitis, but the least understood in this condition; and asymptomatic inflammatory prostatitis. As I mentioned before at the beginning of the video, 90% of men experience some type of prostate problem at some point in their lives. And unlike an enlarged prostate and prostate cancer, which commonly affects older men, prostatitis affects men at all ages, especially those between 20 and 40 years old. So in today's video, I'm going to reveal how to cure your prostatitis symptoms naturally and effectively. Part 1, supplements. Supplements are extremely helpful. I suggest you take a good look at these, the ones I'm going to mention, and if you can find yourself a good quality formula, do it. Very helpful. Number 1, saw palmetto. Saw palmetto is a short palm tree found in Florida, which Native Americans from the Seminole tribe traditionally ate to treat urinary and reproductive problems associated with an enlarged prostate. And one of the most well-known saw palmetto benefits is its ability to improve prostate health and urinary dysfunction in a natural way. According to recent studies, saw palmetto can bind to receptors in that lower urinary tract, improving urinary symptoms of prostatitis, like an overactive bladder and even benign prostate hyperplasia symptoms. You can find saw palmetto in capsules in most health food stores, which is readily available, and research has shown that it has no drug interactions and doesn't cause any adverse effects. If you need a quality supplement, visit drlandivar.com. I encourage you to take this natural remedy. It's very effective and can really do wonders. Number 2, quercetin. Quercetin is a supplement and a natural treatment that's gaining respect in the medical community. This substance is a flavonoid found in many plants and foods, especially red grapes, red wine, apples, tea, berries, and onions. For more than a decade now, quercetin has been recognized as a potent antioxidant that has anti-inflammatory and anti-allergic effects, and research is now suggesting it can be helpful for men with bladder, prostate symptoms, and pelvic floor pain or spasm. In one study, patients were administered 500 milligrams of quercetin twice a day for 4 weeks. The patients with chronic prostatitis, which is the type of prostate more difficult to treat, showed significant improvements and reduced inflammation over the placebo group. This supplement normally comes in capsules of 500 milligrams that you can take easily with a meal. Number 3, bee pollen. Normally, you would think that bee pollen is only helpful for treating allergies or respiratory immune conditions. But believe it or not, bee pollen can also be used to treat conditions like prostatitis. Bee pollen has been used in Europe for quite some time now to treat prostatitis, and studies show that bee pollen can be very effective because of its anti-inflammatory, analgesic, and anti-androgen effects in males. In fact, the efficacy of bee pollen has been compared to anti-inflammatory drugs, according to research actually published in Evidence-Based Complementary Medicine magazine. Clinicians confirmed that a non-bacterial prostate inflammation improves with bee pollen. What it does is effectively removes pain. One way you can use bee pollen is grounding them into your daily foods like yogurt, cold soups, or even juices. To reduce inflammation and boost your prostate health, I suggest you take 1 teaspoon of grounded bee pollen 3 times a day. Supplements are a very important part of this treatment plan, but diet is another pillar that must never be ignored. Part 2, diet. Number 1, avoid inflammatory foods. Believe it or not, inflammatory foods play a huge role in conditions like prostatitis. So it's important to pay close attention to what your diet looks like and what you're eating. So if you want to relieve symptoms, avoid triggers and inflammatory foods like refined carbohydrates, too much sugar, artificial sweeteners, spicy foods, which by the way is very important, acidic foods, alcohol, and too much caffeine. All these foods cause allergic reactions and lead to inflammation in the body that contribute to pain in the pelvic area and the lower abdominal areas. Number 2, practice an elimination diet. There are exceptions to the list I just mentioned, and sometimes it's not the typical inflammatory foods that cause prostatitis. So it's important to pay attention to food allergies or intolerances that can cause inflammation and pain. In this case, I suggest you use an elimination diet to try to discover what common allergens in your diet are causing the problem. What you can do is remove common allergenic foods one by one, trying to notice differences in your health or symptoms in the course of 4 weeks after cutting off that specific food. So for example, try eliminating soy, milk, gluten, even corn, alcohol, peanuts, or eggs, certain processed foods, etc. After about 4 to 6 weeks of avoiding that specific food, your symptoms may begin to dissipate. If this is the case, then you know that one of the foods that you've been cutting off, is to blame. And just to make sure this is the case, one by one, begin adding these foods back into your diet and pay close attention to how your body reacts. This will help you out in pinpointing what specific foods are causing the problem. Number 3, eat healing foods. Avoiding certain foods is crucial, but just as important is consuming foods that will aid your body in combating prostate inflammation. In case you didn't know, the prostate is highly affected by hormone levels in the body, and hormone levels are greatly affected by the type of foods you're eating on a daily basis. This is why eating a balanced diet is one of the most important things in prostatitis treatment. This means that consuming whole and natural foods can relieve your symptoms in many cases. So here's a list of foods you can consume regularly. So take good note. High fiber foods like beans, legumes, squash, berries, pears, nuts, and seeds. Organic, good quality protein like grass-fed beef and wild-caught salmon. Omega-3 foods including wild-caught fish, walnuts, flax seeds, and chia seeds. Vegetables, especially leafy green vegetables and cruciferous vegetables. Fruits, especially berries. Healthy fats like grass-fed butter, coconut oil, olive oil, and foods high in zinc like pumpkin seeds. Organic lamb, yogurt, kefir, and probiotic-rich foods, very important, like yogurt or even supplements. Part 3, lifestyle changes. Believe it or not, lifestyle changes are very important, and this has a lot to do with hormone levels. You see, our lifestyle has a great impact in hormone regulation, so it's important to keep them well taken care of. Number 1, exercise. A review of several studies conducted in Stanford University says that all studies performed between 1976 and 2002 reported a reduced risk rate of prostate cancer in men who were more active in their lives. The average risk reduction ranged from 10 to 30% of people who had regular physical activity in their lives. Researchers believe that exercise modulates hormone levels, prevents obesity, enhances immune function, and reduces oxidative stress. This explains why exercise has such protective qualities against prostate conditions. Number 2, reduce stress and get some rest. It's also very important to work on reducing stress and getting enough sleep every night, at least 7 hours each night. This is definitely a risk factor for prostatitis. Very important. Help out the channel by giving this video a thumbs up and sharing it with your friends and family. And if you have any questions, leave your comments down below and I'll be happy to assist you. If you need quality supplements for your disease or an online appointment, visit drlandevar.com. And right over here, I suggest you check out these other videos related to this topic. You're going to find valuable information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.